The way we look at healthcare in general across the world and in the U.S. in particular is quality adjusted total cost of care. Quality until recently has been hard to measure, but thanks to the CMS, the government, and Medicare, they are measuring every procedure for every doctor at every hospital in every county in the country. So the landscape is we have the employers are paying way too much and this huge variety of how much they're overpaying within a state, within a catchment area, and clearly across states. They're trying to make this consistent, both because there are a variety of constituents with a vested interest in trying to deal with this. At the highest end, you have hospitals who have too many beds and not enough heads in beds and are concerned either because there'll be a Medicare for all or because the managed care organizations will eventually, through their employers, put pressure on them. They are trying to buy up both other hospitals to increase their market power and buy up a variety of the doctors who are the referral doctors that will send them back into their hospitals. The second group coming in to buy them are private equity firms. So private equity firms are going off and they're buying urgent care clinics, they're buying freestanding emergency departments, they're buying call them high velocity specialists. The third group is the payer, the managed care organizations. So the managed care organizations are actually going off to buy referral docs, private practice folks, primary care physicians, in order to make sure they control the referrals. The hospital setting is an incredibly inefficient factory, but the argument and the facts are that a significant portion of the health care that we're getting in the hospital can be done outside of the hospital. And it is inherently done for less because there's less fixed cost that you need to amortize to price the services. So for the sake of argument, it's half price to do the same thing outside the hospital setting versus inside the hospital setting. In the landscape of American providers, which is the dominant part of our cost structure. It's 70% of our cost is providers. In this nearly $4 trillion world we live in now, that is a lot of trillions that go to providers. There's 10,000 hospitals, there's hundreds and hundreds of thousands of clinics. They're all different geographically, and there are 4 forces at work buying them, and it's time for intelligent people to act now, recognizing at the same time that we could also have the large Medicare for all phenomenon taking place as a massive tidal wave sweeping through this entire asset structure.